Yeah, just a quick review of the Gymreapers knee sleeves. So this sleeve is made specifically for people that are having some kind of knee pain or some kind type of knee problem. Some people actually use the knee sleeves actually to prevent a problem, like if they're doing in the gym, they're doing a lot of heavy leg work, a lot of squats and stuff. Just get that extra support so they don't, have any knee problems. So some people use them as a preventive measures, but largely a lot of people are putting these if they have pain. The idea here is that you put on the sleeve. It supports the joint. It also supports the surrounding soft tissues, and it restricts the motion a little bit. So that way your knee has a chance to kind of rest, recover, and doesn't get so stressed out as you're doing certain activities. So a few points about this particular sleeve. This is one of the thicker sleeves out there. It actually has 7 millimeters thick neoprene. So that's actually pretty good. So it's pretty thick. The other thing I like about it is that it comes with it comes with a carrying bag. Comes with a little gym bag there, so you can carry stuff around. I thought that was good. But anyway, other things you can do for your knee besides putting on a sleeve, a few examples. You just use this book as an example, Bulletproof Your Knee. If you have any kind of knee problems, you want to keep your quadriceps muscle strong. Your quad muscle is a muscle on the top of your thigh here, and just above your knee is your kneecap there. It's the main stabilizer of your knee. What they're finding, just about any knee problem you can name, they find researchers take groups of people with that problem and they test their quads and they find that they're either weak or they're actually smaller than normal if they look at like cross-sectional scans on a CT. But anyway, so lots of problems with the quadriceps muscle. In fact, this whole chapter is just dedicated to all the problems, certain problems and the problems they're finding with the quads. For instance, knee swelling in the quads. This study showed that even if you have as little as 20 milliliters of fluid in your knee, which is just over a tablespoon, it's enough to decrease the strength of your quadriceps muscle. So if you have any kind of chronic knee swelling, it's probably taking its toll on your quadriceps muscle. Knee injuries in the quadriceps muscle, if you had a prior injury, something like, if you fractured your tibia, or if you've had surgery on it, they've opened up the joint, could probably have quadriceps weakness. Ligament problems, anterior cruciate ligament, that would be your ACL. If you had a tear or any kind of rupture of it, your posterior cruciate ligament, studies showing, hey, these people have problems with decreased quad strength. Medial collateral ligament, ligaments around the knee definitely affect the quads. Just having knee pain is enough to decrease the strength of your quads, chronic knee pain. Knee arthritis in the quadriceps, really interesting. So if you take a bunch of people with knee arthritis and you look at their strength of their quads, it's definitely weaker than normal. But likewise, they are actually randomized controlled trials showing that if you take people with knee arthritis, you strengthen just their quads, our knee arthritic pain starts to go away. So it's definitely crucial. And they find if you strengthen your quads, it actually slows the progression of knee arthritis. So that's actually been shown in some studies. Patellofemoral pain syndrome, the list just goes on and on. So definitely make sure you strengthen your quads. Fine-tune control over your knee. Here they're talking, I think, mainly about the hip muscles. Sometimes you have a problem at the hip that's actually affecting the knee. So the problem isn't actually in the knee itself at all. It's just because there's something going on up at the hip. Classic example is iliotibial band syndrome. So if they take people with iliotibial band syndrome, groups of people with that, and they check out the strength of their muscles, they find they have trouble particularly with their hip abductors. Okay, a hip abductor brings your leg out to the side. That's what that muscle does. Likewise, they say if you take people with iliotibial band syndrome, and this is in randomized controlled trials, if you take people with iliotibial band syndrome and you strengthen their hip abductors, iliotibial band syndrome goes away. Isn't that interesting? So the problem's really all up at your hip. Knee range of motion. Of course, you want to make sure that you keep your knee flexible. A lot of people know that your knee, of course, it bends and it straightens. What a lot of people don't know is that actually about the last 15 degrees of you straightening your leg, your knee actually rotates, okay? And here's a little test to see if yours does that. So that's an accessory motion of your knee that you actually have. You have to have fully functioning knee. Other things you can do, there's some stretches there. Increase dynamic knee stability. Here they're talking about proprioception. So proprioception is your position sense. So if I suddenly turn the lights out, you're able to tell me if your knee is bent or straight, okay, normally. But what they find, so that's proprioception. So that they find with people with knee problems, it's just proprioception isn't what it's supposed to be. And so that can really make a difference if, say, your reaction time, you got to know where your knee is. Like, let's say you step off a curb unexpectedly, you need that reaction time. You need to know where your knee is and to correct that position right away. So proprioception is kind of a big deal. So a lot of things you can do. But hey, nothing's as quick as popping on a knee sleeve, get that instant support. Usually feels good, makes the pain go away. So good knee sleeve. Check it out.